Hi, my name is Dane Black. I am the medical director of the urgent care here at Adena. Been in the community for about 3 years now. So we've done a lot of changes in the urgent care, particularly with how we have patients wait, because sometimes whenever things get busy, there was lots of people in the waiting rooms, and the last thing we want during a pandemic would be to have those people in close proximity to each other. So one of the first things that we did was to implement a in-car waiting system. So that would include registering at the front door, being given a mask and a sign-in sheet, and then you do all of your registration and kind of pre-visit paperwork over the phone. Once you're ready, you're called by the nurse and then brought in through either the front door or the back door based on whether or not you have respiratory symptoms. We're separating those folks out. So we have a back hallway that we're bringing all of our respiratory or ill patient cases in, and everybody who's more injury style or there for other reasons who are asymptomatic, we bring in the front door, trying to keep people obviously separated from each other. Everyone is masked now 100% of the time that they're in our building. The providers, the nurses, the phlebotomists, and all the patients. So that obviously lots of studies to support that reduces the spread, just trying to keep everybody as safe as possible. Sure, so I mean, you think of an urgent care as halfway between family medicine and halfway between emergency room. So we deal with minor injuries, cuts, scrapes, small breaks here and there. We obviously offer x-ray. Point of care testing, it means that tests that can be done quickly, so we check for urine, we check for strep, flu. Here in about, I think, probably a week or two, we will be testing for doing the coronavirus swabs as well. And we do have a full service lab, so we do offer some blood work here and there depending on the situation. So virtually, we'll see anybody that walks in the door, and we'll, try to get them to the right place if they're in the wrong place. Virtual visits, we do have a provider doing that, so at any point you can call and be routed through a telemedicine type thing. If you have an iPhone, you can do FaceTime. If you have a computer, you can set up a program that allows you to have a face-to-face conversation. So the application of that would be, again, anything that doesn't require auscultation, which would be listening with a stethoscope. Minor illnesses that you can do visualization type stuff. Even sore throat, you can have a swab ordered for you and have that swab done out in the clinic and never have to come inside the urgent care. I would say things that would be more appropriate to come to the urgent care, obviously anything that needs hands-on, so injuries. I mean, if you cut yourself, it's not going to help if you're on the phone. So anything of that nature, we would like to come in and have you look at it. And then, of course, anything that would require us to look in the ears or listen with the stethoscope with such as, cough, shortness of breath type situations would be much more appropriate to actually come in person. From an injury type standpoint, there's no reason to call ahead. If you show up at our front door, we're open, we're there, we're happy to see you. In that case, as we discussed before, you would be given a mask at the front door, you'd register in the car, and then because you're a non-ill patient, you would be registered and brought in the front door and set in the hallway that is the non-respiratory hallway. So you're never touching the same air as the non-respiratory patients. Depending on the exam, you'd likely have an x-ray done, or obviously if there's a small cut, laceration type situation, we can of course close those. That's every day for us. I would love for patients to know that we are open. The absolute last thing we want is somebody to have delayed care that causes a poor outcome in their health. And I think that stands true for many of us here at Adena. We're open, we're doing everything we possibly can to keep patients safe. And we would really like to, be a part of that, and I don't want anybody to think that we're closing our doors or reducing our care just simply because we're in the middle of a pandemic. That's when we're at our best. This is what we signed up for, and this is what we want to do, is to take care of people that need it.